and thank you for joining us today for IFFGD's 2021 Virtual Advocacy Event. Today, we are focusing on finding resources for the various needs that all of us as patients with GI disorders sometimes finding ourselves needing. In this session in particular, we're going to talk about resources from the American College of Gastroenterology, or the ACG. The ACG is actually a professional organization of healthcare providers that focus on the prevention, diagnosis, and treatment of digestive disorders. Although they are not a patient organization, they provide some very valuable resources to patients. One of these is GI OnDemand. GI OnDemand is actually a joint venture between two organizations, the ACG and Gastro Girl. We're going to talk today a little bit about GI OnDemand and also about Gastro Girl. And so here with us today is Jackie Gaulin. Miss Gaulin is the founder and chief strategy officer for both Gastro Girl and GI OnDemand. And also a familiar face for those of us here at IFFGD is Dr. William Chey. Dr. Chey is the Nostrand Professor of GI and Nutritional Services at the University of Michigan, and he also is the Director of Nutrition and Behavioral Integrated Health Services at GI OnDemand. Thank you both and welcome to IFFG's 2020 Advocacy Event.
Thanks.
Thank you. Yes.
So thank you so much for being here today and helping us to learn just a little bit more about these important resources. And for those out there, I just mentioned that GI OnDemand is a collaboration between ACG and Gastro Girl. And I am sure when I said that, all of you started wondering, what is a Gastro Girl? So Jackie, can you tell us just a little bit about Gastro Girl and why did you start Gastro Girl?
Thank you, Cecile. Yes, Gastro Girl started off about over a decade ago as a blog because it met an unmet need at the time for educational information about digestive health issues. And it brought that information that was evidence-based, but in a lighthearted, accessible way for patients. And I was very passionate about digestive health. And I'll save you the long story. There's lots of information on that online. But basically, after my role at Revolution Health, where I started Gastro Girl as a blog, I ended up at the American College of Gastroenterology, where I worked for 6 years in a communications and digital engagement capacity. And I loved working there. I learned so much. I met so many amazing clinicians. And I also had the opportunity to really further understand the journey that patients had. And then there was a gap between once a patient was diagnosed or they were trying to find a diagnosis, there was really nowhere for them to find information and resources that was really targeted for them and to really have that support between office visits. And this is, a while ago. And I just had this burning desire to continue the mission of Gastro Girl that started off as a blog. And I became a certified health coach where I was able to really understand what patients need, how to speak with them, and it just evolved. I left ACG as a full-time employee to, put it all on the table. And I founded Gastro Girl. We were in a health tech accelerator, which what that means is sort of like a test area where you develop the initial product, you test it, and we did that. And then we spent about 2 years courting the ACG. Even though I worked there, it wasn't an easy, oh yeah, we love you, come on, let's partner. It was really a very strategic, a very important process. We had pilot studies. We had to go in front of the board of trustees. Dr. Chey, you remember those meetings, and it was really a collaborative approach because it brought together, GI OnDemand really brings together the expertise, the reputation, the reach of the American College of Gastroenterology, and also the advocacy for patients. And just Gastro Girl was pretty recognized in the industry among patients and providers. Sometimes there are people that don't even call me my name. They just call me GG or Gastro Girl. But it's really not about me. It's really like the superhero patient advocate. And bringing those together with ACG, we were really able to take the mission of Gastro Girl and accelerate it under the guidance of amazing clinicians like Dr. Chey, who's on our leadership team, and others who were able to really evolve it into the platform that it is and is becoming today. So it's been an amazing journey. It's not over yet. You know, you're doing great work with IFFGD. So the goal of GI OnDemand is not to operate in a silo. It's really about bringing all the pieces together. So it's almost like Gastro Girl did all the blazing the trail to get, you know, a really good collaboration with the college. And now we're like, okay, everybody, let's all work together and bring these amazing resources to clinicians and their patients.
Fantastic. Wow. So it's really been a journey. And I actually remember you and I met when this was all beginning about a decade ago, when, you know, I think we're both in different lives back then. It was definitely pre-IFFGD for me. So Gastro Girl, is it now completely integrated with ACG and GI OnDemand, or is there something different with just Gastro Girl?
That's a great question, and we get that a lot. So think of it like this: Gastro Girl is its own company. It's Gastro Girl Inc. ACG is a very highly respected nonprofit organization for GI clinicians. We've come together in an official joint venture partnership. It's an official LLC, GI OnDemand, and it's equally owned by both Gastro Girl and the ACG.
Okay, so if someone goes to Gastro Girl, what would they expect to see on Gastro Girl's website?
So at Gastro Girl's website, it's really various resources. Again, we're not, you know, we're not recreating the wheel. We're not doing what you're doing or what the CCF, the foundation is doing, or other patients. We're really taking a unique twist on empowering patients, more like a lot of living with information. We just unveiled a podcast series that's been amazing. We have a virtual book club, and we're featuring books that are written either by patients or for patients, or we're going to feature Dr. Jossman's book, Gut Feelings, I think during IBS Awareness Month. So we're really bringing a different twist. It's very information oriented, evidence-based. We have a community that we offer in partnership with ACG under the GI OnDemand brand. So it's very accessible. Right now, there's no charge to join the Gastro Girl site. You can go on there, and there are really great things that are coming down the pipeline as well. Always evolving, always iterating, always listening to our patient population. And so that's
fantastic. That sounds so exciting, and your passion is absolutely infectious. And so that sounds like a really fantastic resource. Let's talk a little bit about GI OnDemand. Dr. Chey, I know that you and I have talked about this quite often. We've talked about integrative care, and I know that is really the niche that GI OnDemand is looking to fill, right? That is the need of patients. That is what all of us talk about. But can you kind of put it out there where we can all really understand when we say integrative care? What does that really mean, Dr. Chey?
Yeah, if you think about the care model that most patients with conditions like irritable bowel syndrome or other so-called functional GI conditions have been treated with, it's really revolved almost exclusively around a relationship with either a primary care provider or a gastroenterologist who chooses a medication to address that particular patient's symptoms. And what we've come to learn over many years now is that patients oftentimes want something more than just a medication. You know, in fact, I see you both shaking your heads. It's amazing because for many years, I would interview a patient and arrive at a diagnosis, and then I would say, and we're going to treat you with this. And the patient's response would be, but wait a second, doctor, what can I do myself about my diet and about things in my everyday life that might allow me to not have to use a medication, or that might make the medication work better? And, you know, for years and years, we really didn't have a good answer to that. But over the last 10 years or so, there's been this incredible growth, expansion of knowledge around non-medical treatments for patients with conditions like irritable bowel syndrome. So around diet, around behavior. lifestyle. And more, we're thinking about incorporating, recommending those types of strategies to patients. Now, here's the problem is that most gastroenterologists in the United States are not adequately trained to be able to take a deep dive into those dietary recommendations or behavioral lifestyle recommendations. They'll tell you to eat smaller meals, avoid fatty foods, eat more fiber, right? Um, but as far as being able to really provide the types of detailed information that would allow a patient to embrace these recommendations and incorporate them into their day-to-day lives, we just don't have the training. So increasingly, we're talking about using the services of specially trained GI dietitians or specially trained GI psychologists, behavioral therapists, and having people work as a team, because there's a big difference between multidisciplinary care, where different providers all take care of their little piece of the pie, versus integrated care, which is collaborative, team-based care, where people of different ilks, dietitians, behavioral therapists, gastroenterologists, work as a team to come up with an integrated treatment plan for that individual patient. If you think about it, people talk more and more about personalized medicine, you know, and this whole idea of integrated care is getting us closer to that aspirational goal of a personalized approach for patient A versus patient B.
That makes so much sense. And I have to tell you that I've never heard it explained in such a way, the difference between multidisciplinary care and integrative care. And that makes so much sense to me. Thank you so much for that explanation. Now, during that explanation, Dr. Chey, you mentioned irritable bowel syndrome several times. And I know that many of the folks watching today do have IBS, as epidemiology has shown us. There are millions of people in around the world that have irritable bowel syndrome. And I know that a lot of research has been done in this patient population with integrative care. But what other patients would benefit from this type of a program or approach?
The data is evolving very quickly in IBS, and obviously cancer, GI cancer, we've been talking about multidisciplinary care and integrated care for a long time. But really, if you think about virtually any disease in gastroenterology, whether you're talking about chronic pancreatitis, eosinophilic esophagitis, gastroesophageal reflux disease, gastroparesis, inflammatory bowel disease, all of these different things are going to be amenable. In fact, care will be significantly enhanced by thinking about a more holistic, integrative, collaborative, team-based approach. And there's not as much data in many of those places as just as of yet, but it'll come. I mean, if you just think about it from a purely intuitive standpoint, it really makes sense that for many of these conditions, we should be thinking about diet strategies. We should be thinking about how the mind influences the gut and how we can modify that in a way that will help with the patient's symptoms.
That is, that I think it's so exciting for patients, especially those that have more than one condition, and then medications might interrupt with other medications that interfere. And the thought that you can do something integrative, something that is non-medicinal in some cases, and just being able to work one-on-one on you and have a very personalized approach. That is such a hope for the future. And like you said, we're just one step forward to that with this. And talking about one step forward, I do know that GI OnDemand has some really big plans to try to provide this for patients. Not available yet. For those of you listening, please stay tuned with IFFGD and we'll let you know when it's available. But can you give us a little sneak peek of what GI OnDemand is hoping to achieve in the future?
Yeah, absolutely. I mean, it's an exciting time because here's the thing is that virtually every provider, gastroenterologist, primary care doctors, any specialty, as well as patient, has now been touched by the concept of virtual care or telehealth. I think we're all engaging on this on a daily basis. And so it's an exciting prospect to think about utilizing telehealth or virtual care to build integrated teams. And like you said, some of those things will be coming in the very near future through GI OnDemand. Right now, some things that listeners might be interested in are free webinars that we have available that provide information around interventions like the low FODMAP diet, for example, for irritable bowel syndrome. I'm really thrilled that one of our dietitians, Emily Haller, is actually working on that. There'll be a webinar coming up on elimination diets for eosinophilic esophagitis, also by one of our dietitians, Amanda Lynette. We'll have webinars about potential ways or to help people to understand how the brain influences function in the GI tract, which can manifest as a variety of different symptoms like pain, diarrhea, or constipation, the typical symptoms of IBS, and how behavioral strategies can be beneficial for that. So right now, there's a lot of informational offerings that I think patients will get a tremendous amount of benefit from. The people doing these webinars will be able to take that deep dive. The doctor just simply either won't have training or won't have time to be able to do during their interaction in the office.
Absolutely. And for those of you who are familiar with IFFGD programming, Emily Haller, who Dr. Chey just mentioned, you may know is not only on the advisory board of IFFGD, but also the chair of our digestive health chat on Twitter. So if you enjoyed that program, you probably really should be tuning into the GI OnDemand's diet and nutrition program as well. So thank you so much. And I know that there's a lot to come, and there's a lot more in store with this powerhouse of a collaboration between Gastro Girl and the American College of Gastroenterology. Those of you at home, please stay tuned to GI OnDemand, and remember to be thinking about that when you're thinking about your healthcare and how you would wish that it would be more integrative. Check out GI OnDemand, and I'm sure that you'll learn a lot about how to provide that for yourself and for the ones that you care about, whether it be a GI illness or otherwise. This will probably help you get pointed in the right direction. So again, for those of you who are just watching us or just joining us, this is part of our IFFGD 2021 Advocacy Event. Today's session is all about finding resources for you as patients with GI illness. And in this particular program, we were talking with Miss Jackie Gaulin from Gastro Girl and Dr. William Chey, who is on the board of IFFGD, a very wonderful special advisor to me at the organization, but it's also been one of the powerhouse brains around trying to get this available to patients. And now finally, he has helped to create GI OnDemand. And GI OnDemand, which is a collaboration between ACG and Gastro Girl, is intended to help patients find that integrative care that they are so desperately looking for to help them in their disease. For those of you who would like more information about either of these, visit our webpage for our advocacy event, and we will make sure that you get a link there to both Gastro Girl and GI OnDemand. You can join those communities and begin to learn. You can watch the old podcasts and hear about when new ones are coming that Dr. Biltake told us about. For those of you who would like to learn about other resources other than GI OnDemand and Gastro Girl, stay tuned to this program or visit the IFFGD 2021 Advocacy Event webpage, where you'll see the entire agenda, all the talks for the day and for the entire week, and links to the YouTube videos so that you can learn about other resources as well. Ms. Gaulin and Dr. Chey, thank you so much for spending time with us this afternoon, helping us to understand a little bit more about integrative care, about patient resources, and these wonderful two platforms that you guys have helped to create. That is such a great resource for GI patients. Thank you.
Thank you.
And for those of you at home, please stay continued watching our program, and we hope that you learn a lot about resources for GI health. Thank you.